So when you go for your medical, there's a lot of anxiety, a lot of uncertainty, because it's not a very pleasant thing. Nobody looks up to it that, oh, my medicals are coming. You may be looking up to your birthday or some festival, but then going to a doctor, getting a prick, and some uncertainty is there in the process. You had to stay there for 3 days, and sometimes they may ask you for additional tests. So how do you prepare? You have to, firstly, your documentation should be correct. What all documents that you have to carry with you, your photo ID, your photographs, passport size photographs, your last medical assessment, prescription of your glasses. So you all have to carry along with. And second thing is your preparation. So you must be aware of the venue, where is the medical. Otherwise, that will add to your stress if you have to search around at the last moment, and that too if you are late or not on time. And then lastly, you have to be fasting. Most of the time, the medical is fasting, and you shouldn't smoke that day. And also, you should not have any coffee. You should go well rested and well hydrated. So that's a preparation. Then on eGCA, you have to submit your application and validate your application. So which means you have to upload your last assessment and your photograph. After that, you have to validate the application. Validation means what you have stated is true. So these things have to be done by the applicant, that is you. To sum up, medicals are the important part of your fitness and your ability to keep flying, to maintain your health. And I have told you what are the basic commandments or essentials of remaining fit. And now if you have any queries, you can ask me. You may have few things in your mind, some personal problem or some specific issues you might have encountered during your medical. So, or anything else you think you would like to know from me. After all, I have been in this profession for 40 years, and then we have been interacting with so many pilots. We see pilots across the spectrum, foreigners, expats, men, women from all airlines, scheduled, non-scheduled operators, initial medicals, renewal medicals, special medicals, and then we see so many youngsters like you. So if you have any queries in your mind, you can ask.
Sir, there are certain medical issues which are temporary and can be fixed later, whereas there are certain other medical issues which cannot be fixed and will be disqualified. So can you please share some details on that?
So there are so many conditions. So what you mean is temporary. Certain situations may be transient. You may be having cold or fever, or girls may be having their periods. So that doesn't make you unfit. So some of the values in the blood report may go out of range. So they give you a chance to redo those tests. Maybe you are not fasting properly. Maybe you are stressed out. You didn't have sufficient water before giving the samples. So the medical examiners or the doctors are aware of those facts. So they will not let those come in between. If there's some problem in your report, so your BP is high transiently because of the stress, anxiety, they will do it again. They'll make you feel relaxed, comfortable. So these kind of situations are transient. Then if there's something more which has been found, say your blood sugar is high, or you had a fracture or injury recently, so then your body needs rest, or you need some medication. So in that situation, you will be put down, which is called temporary medical unfitness. So that is mostly for a period of 4 to 6 weeks, after which you go again to the boarding center, they upgrade you. But there are very few conditions. If you've done your class 2 and 1 initially, very few conditions can lead to your permanent medical unfitness. And most important of those are some mental disorders. Because if there's something like schizophrenia or maniac depressive psychosis, the diseases you may not heard of, but which are related to your mental health, and you can't, you're not aware of your environment, or you don't have insight of yourself, you're kind of disoriented, then they big no for any flying duties. They disqualify you from flying duties. So another important thing is with flying, only certain drugs are permitted, which are safe, which have no side effect, and which are compatible with flying. So you should not be taking any drug. If you're taking any medicine or drugs, that means you have some problem. Even vitamins you don't need to take because you're young and taking a balanced diet. So that also you're not allowed medicine. But if you're taking some medicine, it should be after clearance by the medical examiner or expert in this field. And the permanent conditions, of course, where one can't recover, or which are going down the hill. or so they disqualify you. So in the class 2 medicals which we do, the most important things are your color perception, which is weak. Color blindness, some people turn out to be color blind. So color is very important in aviation. You have to see the radar, runway lights and navigation aids. So color perception is one thing. Second thing is the eyes are most critical because 80% of your sensory input from the vision. So if there's some problem inside, retinal detachment is there, high levels of prescription of glasses, the myopia is there, and then that also disqualifies you. So the conditions which outrightly disqualify you are mentioned in the beginning only. And most of the conditions pertain to your vision, or somebody has insulin wherein he has to take injections. So those kind of conditions debar you, or if you have history of head injury, if you had seizures, so that condition is called problems which can lead to in-flight incapacitation. So in-flight incapacitation is a situation where you have a physical incapacitation or mental, cognitive. You're frozen on the controls, cognitive incapacitation. So you're not able to fly the aircraft safely, and it can lead to accident due to some gallbladder stone or a kidney stone. So you get an ultrasound done, suddenly there's a stone in your kidneys. And certain conditions which may be allowed on ground, but they will not be allowed in the flying. Because flying, it's not only your life, but you're carrying so many passengers along with you. So that's why those conditions which may be acceptable in civil or in ground duties may not be acceptable in flying. So they too will put you down, say if the gallbladder stone is there or the kidney stone is there. They'll put you down for 4 weeks. Maybe it will be expelled spontaneously, or you will need a minor surgery. After the surgery, you will be upgraded. So once you cleared your class 2 or class 1, you have to just take care of your health, follow the basic tenets or norms which I have just shared with you, and everything will be okay. If something happens, after all, it's a human body, anything can happen. You are not a robot, so that your body will keep running perfect. So in that situation, after some, they'll put you down and then you again be upgraded. So no need to worry, no need to conceal. So anything else?
According to aviation health guidelines, what should be the minimum hemoglobin level of aviation personnel, including pilots, cabin crew? Can you please explain, sir?
So the minimum acceptable level is 12 gram of hemoglobin for women and 13 gram for men. So why you need good amount of hemoglobin? Because hemoglobin is part of the blood, is a iron molecule which transports the blood, transports oxygen in the blood. So it delivers oxygen to all parts of the body. So if hemoglobin is low, then sufficient oxygen supply will not be there to the critical organs like brain and kidney. And when you are high in the high altitude in sky, so you're flying at 6,000 feet or even 10,000 feet, then as such there is a situation called hypoxia. So then even there will be further a problem of low hemoglobin because oxygen carrying capacity will be compromised. So these kind of conditions are very common. You get earache when you are descending, called otitic barotrauma. So there could be various reasons. After all, human body is complex. It is a wonderful machine. So I am Dr. Sanjeev Sood. I am telling you once again, my number is also there with your team, your instructors. So I practice in Gurgaon. You can get in touch with them. You can inquire my number, and then you can contact me and come one of these days, and we can do the class too. Or you can all come together. That is also possible. And Top Crew Aviation will help you in generation of your eGCA ID and password. Another thing you need is a computer number. You all must be aware by now. You have to upload your 12th class mark sheet of physics and maths on the www Pariksha website, and you get your computer number, which is a 12-digit number and like a roll number, and which helps you clear the exams. The 6 ground subjects mandatory exams which you have to clear. Anything else you want to know?
Hi, good afternoon, doctor.
Okay, good afternoon. Where are you calling from? Just introduce.
I am from Jaipur, October batch.
Okay. I didn't notice you. You all are also there. Okay, tell me please.
Good afternoon, So at this concern, I had gotten this surgery for varicose veins. I've gotten 3 surgeries. So at this concern, while giving my class 1 medicals, of course the doctor will know about it, right? So will this like surgery cause any problems or something?
No, these days the laser is available, which is done by surgeons, and they just give an injection in the OPD. It's a OPD procedure. I wonder if you're referring to the same surgery. So after that, you regain your fitness very soon, and then you will be cured of your varicose vein. You have to carry a cure certificate from the surgeon. He is mostly a cardiovascular surgeon, and you go with that certificate to your boarding center where your medical is there, and you can share your history. So varicose veins is basically what? If you have dilated and tortuous veins in your legs, which is you must have undergone a Doppler. So there could be a situation where you have to stand from prolonged hours, or there's some obstruction, or it could be hereditary. So it's easily treatable. Don't get worried or deterred. And then there's a complete recovery. Sometimes they advise you to wear the stockings so that the venous return of the blood is improved. And surgery is very effective and safe, and very short also. Okay, thank you very much. It's indeed a pleasure meeting you all. And all the best and happy landings to you. Thank you. Thank you.